How we all doing? Welcome back to Nurse Brainy Academy, an academy for simplified lectures by God's grace. So today we are going to discuss on this will be the beginning of the nervous system, a simplified lecture on the nervous system. Now, but before we do anything in this academy, we always acknowledge God. So we acknowledge God Almighty first. Now, we'll be intertwining these video lectures and the simplified lectures in the Telegram lecture room. So, but today we'll be using the live session. Now, the reasons for this live session is to test students' ability also, to make sure that students are communicating while lecture is on. So I'm going to give you some seconds to beckon on your classmates, share the live link so that they can join. So I'm giving you some seconds. Back. Now, last conducted council exam, a lot of nervous questions from nervous system came out in the last conducted council exam. That is why I said that I and my team that we must discuss on this. That we must discuss on this. So let's pay rapt attention as we simplify this by the grace of God. And get your pens and your jotter so you can write. Then if you have the live session, if you have questions, you can notify me in the live session. Now, when you come live, I want you to also notify me your university or your college for better articulation. Now, let's write. The nervous system is the body's control and communication system. It receives information, processes it, and produces appropriate responses. The nervous system. A whole lot of questions were drafted from this nervous system. And the nervous system is a broad system. We've dissected the endocrine, we've dissected the cardiovascular. Now we're going to also dissect this nervous system, the urinary system, and the respiratory system. These are where core systems and the integumentary system. These are core systems that you will see in your council exams. So welcome. I welcome all the wonderful students in this live session. Please make sure you are communicating with me. When I ask questions, make sure you follow. That is the core reason why we're having this live session. Are we together, my wonderful students? So welcome. I welcome you all. Now, in your notes, the nervous system is divided into two. So inside the nervous system, it is divided into two. Are we together? Inside the nervous system, it is divided into two. Number one is the what? The central nervous system. Hope we can see that it's still a system. And what? The PNS, the peripheral nervous system. So the nervous system divided into two systems also, or category. We have the CNS and the PNS. Write it down. And that is not where we're going today. We want to elaborate on the labeling so that in case this is a VIVA class, in case you are giving this model to discuss in your VIVA, you will know it. That's where we are channeling today. That's why we're using this live. Now, having noted that the first thing you are learning today is that the nervous system is divided into two, the CNS and the PNS. Now, the CNS contains the brain and the spinal cord, central. The brain. You can't do anything without your brain and your spinal cord. Are we together? You can't do anything without your brain and your spinal cord. So the CNS is divided into what? The brain and spinal cord. Then the PNS is divided into the cranial nerves, the spinal nerves, the cranial nerves and the what? The spinal nerves. Are we together? I hope you can hear me. I hope you can hear me. Now, the we're going to discuss now on the structures and the functions of this brain. Looking at the screen, you will see human brain structure. So that's what we want to discuss. Now, this is the largest part of the brain, and this is called the cerebrum. 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 This is the first one we are discussing. In case you are giving this for your VIVA, this largest part is the word, the cerebrum. The cerebrum. This largest part. Please don't forget this. This largest part is the cerebrum. So now, first question. For being in today's class, what is the largest part of the brain? Cerebrum. I believe you're a council student, you should know this. Now, what are the functions of the cerebrum? It helps in what? Thinking and reasoning. So your ability to listen to me now and you are articulating, comprehending what I'm saying is as a result of what? Cerebrum. Your ability to prepare for council and you passing your council exam is how sharp and how fast your cerebrum is. Now, this is a different discussion. I don't want to go into it now. How ways students can make their cerebrum faster. This is a different discussion. I wouldn't want to go into it. So, the cerebrum is the largest part of the brain. For someone to drive a car is because he or she has trained the cerebrum. So, you that cannot drive a car is because you've not trained your cerebrum. So, that bringing it to your study, for someone to know research, for someone to know microbiology, for someone to know med surg, for someone to know anatomy, is in your ability to train your cerebrum. But we will not go there today because I don't want to go in the aspect of learning. We will still have a class on how to train the cerebrum. Now, so cerebrum is the largest part of the brain. It helps in thinking, reasoning, memory, learning. As you are learning now that the cerebrum is the largest part, it is the part for learning. The reason why you're in nursing university or department or you're in colleges of nursing or school of nursing is because your cerebrum has the ability to learn. You entered year 1, year 2, year 3, 400 level, 500 or 300 as the case may be. It's because of your what? Your ability to learn, memorize. Your consciousness, people in coma, the part of the brain that is affected is the cerebrum. So your consciousness is as a result of what? The cerebrum. If someone touches you now, your ability to feel sensation that someone is touching you is a result of the what? The cerebrum. Some of you are holding your phones in your hands now, listening to me. That is a voluntary movement. Your ability to do something voluntarily is as a result of what? Cerebrum. Your ability to understand what I'm saying now is a result of what? Cerebrum. If Nosbreni starts speaking French or Chinese, you can't understand that because the cerebrum have not been trained to understand that. So your language ability, procession, your ability to speak is a result of what part of the brain? Cerebrum. So the cerebrum is a very articulating part of the brain because it does a lot of function. That is why it is the largest. And this cerebrum is divided into two parts. We have, remember, listen for your VIVA. The cerebrum is divided into two parts. We have the right hemisphere and the left. So the cerebrum is divided into two parts, the right and left. Now, this is how I teach my physical students. When I do so, I ask them to do it practical. And I want everyone to touch their head, on top of their head. Now, that part you are touching is the word, the cerebrum. The cerebrum, everyone. Now, after this class, if you know you did all these things I'm saying you should do, please notify me. This is how I know students that are that are serious. All right. So everyone that touch the top of their head, what they touch now is the cerebrum. Now, when you touch the right side of that top of your head, is the right cerebral hemisphere, the right side of the cerebrum. When you touch the left side, is the left hemisphere. So the cerebrum is divided into two, the right and the what? The left. Please, are we together? Please, I need your chats. I need your comments. Are we together? Hope you can hear me. The cerebrum, this is the largest part, is divided into two, the right and the what? The left cerebral hemisphere. Are we together? Yes. Now, look at this structure here. Yes, I'm impressed with the students' messages and comments in this live session. Now look at this message, look at this structure here. Please don't forget it. Nose brain, after this lecture, we're going to have urinary system, we're going to have respiratory system, we'll have all these things because, like I said, nervous system, the question was so much in main council. Now look at this. Now you will look at this, the structure just below the cerebrum is called the corpus callosum. What did I call it? The corpus callosum is like a bridge. The corpus callosum is like what? A bridge holding the two cerebral hemisphere. This is a bridge. Now, my wonderful students that are following this live section, what the nurse brain said at the corpus callosum is, the corpus callosum is like a gum. It's like these are fibers that allows message to pass from one hemisphere to another. It is the connective structure, the corpus callosum. It connects the left and the right hemisphere together. What do I call it? The corpus callosum. Look at it here. I want, after this class, you will be able. I'm not just here so that you will listen. In this academy, you don't cram. You do what? You learn. What do I say? In this academy, you don't cram. You do what? Learn by the grace of God. Now, look at this. Now, this structure here, in case you are giving this for your VIVA, this structure here is called the what? The corpus callosum. The corpus callosum. And the work of the corpus callosum is to hold the left cerebrum and the right cerebrum together so that they can communicate, so that messages can be passed between them. And what the nurse brain is, nurse brain, very good. I'm impressed with this student that just wrote everything down in this live session. It's like a bridge. Whenever cars have, what is the function of a bridge? This bridge helps cars to flow from this side to the other side. So the corpus callosum is like a bridge that allows messages, informations to flow from one side of the brain to the other side of the brain. Now there is a technology in this corpus callosum. Now, if you are here and you know that you are listening to me, you use your right hand to do things, to write, to do all those things. The part of the cerebral hemisphere that is active is your left cerebral hemisphere. If you are someone that uses your left hand to write or do anything, the part of the brain that is active is the right side, which is the fastest, the most articulated. Now, imagine if there is no corpus callosum, they cannot communicate. So the corpus callosum does not just connect the two cerebral hemispheres. It helps in what? Passing of information, communicating information between the two hemispheres. So people that use their right hand uses the left side of their brain, that is the cerebral hemisphere. People that use their left hand uses the right cerebral hemisphere. So when you are working as a nurse, after you pass, because I'm trusting God that you will pass. And you see a child is being brought to the world, and you see the child using the left hand, you already know what the cerebral hemisphere that child is working with. When you see a child using right hand, you already know the cerebral hemisphere the child is working with. That is why you're in Osce Academy. Not just to pass this exam, because I know you all will pass, but also to become a professional nurses and midwives. Now, we have been hearing about, we've noted two structure now. Number one is the cerebrum and the corpus callosum, which everyone in this class have understood now. Now, the cerebrum, very good, I'm impressed with this student. The cerebrum is divided into lobes. Now, many students always make this mistake and they call it the, the, the lobes of the brain. No, not just the lobes of the brain, but it is called the lobes of the cerebrum. That is why some students will think that the cerebellum is among the lobe. It is the lobes of the cerebrum. Don't forget this. Where we have the word the frontal lobe. From the word, now every wonderful student, like I said, in my class, whenever I am teaching anatomy and physiology, it is practical. You touch, you do it practical in class. But because this is online, we'll go online. But I want students that will be honest to themselves and that will give me feedback that they do these things I'm saying they should do. Why are you making it practical? What you do practical, you won't forget it easily. Now, everyone should touch their forehead. Now, that part of the forehead is called the frontal lobe of the cerebrum. Not the brain, this is the whole brain. But what the lobes are divided, the cerebrum is divided into lobes. Now, the side of the forehead, which you have touched as a wonderful student, is the frontal lobe. Now, many of you, when you are thinking, you see yourself placing your hand on your head, touching your forehead. Some of you will be tapping your forehead. Why? Because that is the most active part. I don't know if I go into this lobe aspect, I don't know if we will cover a lot because I wouldn't want us to, I don't know. But please, are you learning? I want you to learn this. So in case of your VIVA, good day, ma, good day, sir. My name is Nosbreni. Your exam number is this. Today we are going to discuss on the brain. This is the cerebrum. The cerebrum is divided into several lobes. We have the frontal lobe, we have the parietal lobe, we have the temporal lobe, we have the occipital lobe, we are yes. And after that, you notify and say that the frontal lobe helps in what decision making. So some of you, when you are thinking in exam hall, you are hitting your pen in your forehead. Unknowingly to you, you are trying to activate your frontal lobe. You don't know, but that is it. You are hitting your hands on your head, holding your forehead, thinking, trying to hit it. It's because the frontal lobe is the lobe for decision making and planning, for reasoning. Don't forget this. Oh, for reasoning, for problem solving skill. That is the work of the frontal lobe. So the frontal lobe, that thing you are doing in exam hall, unknowingly to you, you don't know that you are using your frontal lobe. A day will come where we will have a simplified class on how to read and never forget. Many students were chatting me and they said, sir, how were we going to read this, that? Number one is trusting God. And after that is the foundation of everything you are doing and praying. Now, but you can use the lobes of your brain, but that will be a discussion of another class. Now, the frontal lobe is the lobe for decision making. As you are sitting down, you decided to sit down. You made a voluntary movement, decision making, frontal lobe. Your reasoning, frontal lobe. That you and your roommates are having problem. The way you reason and understand things, frontal lobe. Your judgment, ability to make judgment in your council exam, A can be the right answer, B can be the right answer, frontal lobe. Your ability to speak, there is a structure known as the broadcast area. The broadcast area, write it down. It can come out in your exam. The broadcast area, B-R-O-C-A, the broadcast area. is the area for speech production for a newborn baby. All my wonderful students, you are in this academy not just to cram. You are not cramming, you learn. A newborn baby that cannot speak, 6 months, 7 months, infant, up to 1 year. The what area? Oh God, what area is being developed? I am moved now to go in depth. I want to be on top, but I want to go in depth now. What area is not developed in an infant or toddler that cannot speak when he or she is being brought to you in the hospital? The broca's area, the broca's area. So, and it's located in the frontal lobe. So that baby that cannot speak for 9 months, the baby is not making a sound. Yeah, yeah, yeah. The part of the brain that is developing is the broca's area of the frontal lobe. Before the baby starts saying mama, dada, that is the development of the what? The broca's area. Please notify me, are we together? You don't cram. In exam hall, you are touching your frontal lobe. You are trying to think. That is because you see yourself touching your forehead. That is because you are trying to think using your what? Frontal lobe. Like I said, it's not it's not the lobe of the brain, but the lobe of the cerebrum, so that you will have a better understanding about that. Now, everyone, all the wonderful students in this live session, I love students to be joining when it is live, so that you'll be following. After that, we have the word. Please share to your friends. That is why is this live. Share to your friends so that they can join and notify me. You share to your friend, because I desire that you all will pass. After the frontal lobe, we have the parietal lobe. Now, everyone, touch on top of your head. Touch everyone, every student, do it. If that's how we do it physically. Now, but I'm not there with you, but touch your parietal lobe. I want you to learn. Have everybody, you have touched your forehead, which is the frontal. Now, everyone, touch on top of your head, where people carry things. Now, I used to give nose brain shortcut. I call the parietal the parents. The parents is on top. After parents, we have children. So the parents, there are two parietal lobe, but we're not going into in depth. So everyone has touched their front parietal lobe. That is the one on top is the parietal lobe, located behind the frontal lobe. Now, in that area, that is the area that processes touch. Remember, all of them are cerebrum. Pain, if someone hits you or anything, that is the parietal lobe. That is why some people, when they feel headache or anything, if they pour water on their head, you see their heads coming down, because the parietal lobe is the most active lobe for pain, pressure, temperature. You see someone running temperature, they say go and pour water on the person's head. They are trying to what? I'm using these examples to what? Make you retain what I am saying. Don't forget. The parietal is the most active lobe for what? Touch. If someone touches you, you are feeling it, is the parietal lobe. Pain, the parietal lobe. Temperature, the parietal lobe. Are we together? Yes, we are together. Just beneath the parietal lobe, we have the children. Like I said, nose-brainy shortcuts. For new students, nose-brainy shortcuts are shortcuts that help students learn and never forget. So I call if you need the discussion on the lobes of the brain, just notify me. I will send it to you later. After the parietal, which I call nose-brainy shortcut, the parents, we have the children under, which are the temporal. So after all the students have touched their parietal, now just beside your ear, we have the temporal lobe, located near the ears. Now, since it's located near the ears, it is for hearing, it is for emotions, it is for understanding language. Are we together? It is for what? Hearing. That, don't forget this. So in your exams, the frontal lobe is for thinking, processing, and all those things. The parietal lobe, which is on top, you are showing your examiner for your VIVA, is for pain, temperature. The temporal lobe is beside the ear, is for hearing. is for memory, for emotional processing, understanding language. It's in this temporal lobe that we have the Winix area. The Winix area that helps you understand language. So that your inability to understand Chinese is because of your Winix area is not developed. Your inability to speak Chinese is because your broadcast area of the frontal lobe is not developed. Next is the what? The occipital lobe. We're going to break these classes into different phases. I think I wanted us to flow everything down. Today we are going to do a lot. That is why after every simplified lecture, I need students to send me their reviews. So I'll know the schools that are following, the wonderful students that are following. The MBA class, we have so many MBAs, 1, 2, 3, 4, 5, 6, and so on, 7, and so on. So I want to know students that are following. And student, how well you comprehended the class, how comprehensive the class is. So please, after this simplified lecture, send me your reviews. So the temporal lobe is for what? Hearing. I'll be faster. Then the occipital lobe, every student touch the back of your head. Just on top, we have the word occipital lobe of the cerebrum. It is for what? Vision. That is why if anybody hits you at the back of your head, you see the person falling down easily because it processes and interprets word vision. Now, wonderful students, I want you to give me the right answer. What is the function of the broadcast area? You can't be in this class and not learn. You don't cram in this class. So this is the what? The frontal area. This is the parietal. This is the temporal. This is the occipital. Now, wonderful students, give me the function of the broadcast area. What is the function of the broadcast area? Very good. I'm impressed with this student. Daisy, I'm impressed with you. The function of the broadcast area is speech production. So when a baby is being brought to you, you should know that the broadcast area, so a child that cannot speak to 6 years, know that you as a nurse that has been in this academy, because this is not just an online group, but an academy. That is why every link I said, go and follow this link, is because after your council exams, like I said, there are things you need to learn. There are things you need to still follow up, whether to further, places to go. There are things the academy has for you. So the broadcast area, when a child is being brought to you, you should know that the broadcast area is not developed. And the broadcast area is located in this frontal lobe of the cerebrum. Now, your inability to understand language, you are being given French, but you cannot understand it. You are being given Chinese, you can't understand it. You are being given any language, you can't understand it. Is what? The Winix area. The Winix area. And is located in where? In the temporal lobe. So as your temporal lobe, very good, I'm impressed. I'm impressed with these students that are in this lab. I am so impressed with you. You people are following. So when we go into some medical surgical aspect like Winix encephalopathy, you know what we are discussing. So your inability to comprehend, remember the temporal lobe is for hearing, but you are hearing, but you cannot understand. As it's going into your ear, you cannot understand. It tells you that the Winix area, don't cram it to the Winix. Now, I'm summarizing. We will still come back online today. Because I have my physical students, we have classes today on urinary system. Though we've gone far on that physically. But we'll still come back today and we'll finish this. But we'll be stopping very soon. I want people to articulate this first before we go in more depth. I didn't plan that we'll discuss on lobe, but we started there so that we'll have a better understanding. Now, another structure is the hippocampus, still located in that temporal lobe. Now, if Many of you here will be traveling out of the country very soon, and the first time you are visiting probably the country that you've gone to, everything will be new. Your ability to form new memories, probably you've not heard of health economics and you are learning it now, is new to you. Your ability to form new memory, you enter your college and you are meeting new people. Your ability to form new memory is because as a result of the word, the hippocampus. Many years ago, there's nothing like AI, nothing like that. But you came across it, you heard of AI. Your ability to, your brain picking it, this is a new thing. Oh. And after many years, if they ask you, have you heard of this? You say yes. It's as a result of the word, the hippocampus. Don't forget it. Probably you've not seen Nosbury shortcut, you've not seen a hippopotamus before. Your ability to see a hippopotamus and know this is a hippopotamus is because of the word, the hippocampus. That's Nosbury shortcut. Don't forget it. Hippocampus helps in what? Forming new memory, and is located in the temporal lobe. So anyone that is having that forgets a lot, especially at old age, is as a result of problem with this hippocampus. Another one is the word amygdala. Amygdala is also in these temporal lobes. It helps in what? Emotion and fear. So we're going to stop here today. Please send me your reviews. We'll come back again for more simplified lectures. Send me your reviews. Hope you learned something. Hope you learned something. God bless you. God bless you. God bless you. Let's move to the WhatsApp group now. Notify me. Send me your reviews. I need your reviews. Send me your reviews. Hope you learned something. So God bless you. God bless you. God bless you. Make sure you are full subscribed so that when we come live later, you get notified by YouTube. God bless you. God bless you. God bless you. Send me your reviews.